Welcome to my training on how to clear the appointment backlog. And you need this training now more than ever. This is Wendy Myers with Communication Solutions for Veterinarians. And for more than 20 years, I've been coaching veterinary teams to become confident communicators so that as a result, more clients say yes, you grow patient care and hospital revenue. I offer monthly CE credit webinars and a new topic every single month. You can find out about my upcoming courses at csvets.com. There's also a great companion handout that you'll get with today's course, and be sure that you grab that download and are able to utilize the facilitator's guide to implement strategies from this training. So here's what we're going to learn today, and I'm going to cover 5 really important areas for you. Right now, many practices are booking 2 to 6 weeks out during COVID reopening phases, and clients may not be able to get an appointment immediately. So I will share with you what you should be saying and also what you shouldn't. We also will look at how can you see more patients, because you need to grow your capacity. And I'm going to give you 2 tricks in looking at your appointment lengths and also utilizing urgent care slots. I want you to change and reset your reminder system and actually start forward booking patients that will be due in the next 2 months. And I'll show you specifically how to do that with some text and email examples. Next, we'll look at scheduling elective procedures in advance, so spays, neuters, and dentistry, again, making sure that we're forward booking those. And then lastly, using online and app scheduling tools, because you don't have time for more phone calls right now. You're already overwhelmed. So how did we get into this hot mess? Well, let me show you the numbers. So typical practice has 2 veterinarians, and we are seeing literally a backlog of 3 months of appointments. During COVID safety restrictions, veterinary hospitals were declared essential businesses, but typically in most states in March, April, and May, we were limited to urgent care and emergencies only in order to conserve personal protective equipment, or PPE, which human hospitals also use. And I want you to think about this 3-month backlog that now we're trying to see during busy summer and fall months. How can you meet this demand? And most importantly, how can you keep your sanity? So here's the numbers. So in a 2-doctor practice, you typically see 300 patients every month just for checkups. You know, your other sick patients, urgent care, emergencies are on top of this. This is just normal, everyday, predictable patterns. So if you couldn't see and were restricted during COVID safety to have those checkups come in, now you're facing a backlog of 900 patients who need to get up to date. Now, while you probably can't achieve 100% compliance on checkup visits, the research shows that typically 70% or higher is what most practices meet. So if I look at 3 months of backlogged patients with 70% client compliance, what that adds up to in a 2-doctor practice is that you need to see 154 patients a week for checkups. And how that breaks down for each veterinarian is 14 checkups per weekday, so Monday through Friday, 7 checkups on a Saturday, because that's typically a shorter half day for us for most practices, and then pile on top of that all of your sick patients and urgent care. So let's fix this hot mess. So the first strategy is this. What do you say when clients can't get an appointment right away?